Hello, I'm Angela. I'm going to be your nurse today. We're going
Hi.
to go over a couple systems for you here and just check a few things. There shouldn't be anything painful, but if you're experiencing any pain, just let me know.
Okay.
Alright, I'm going to start with asking you a couple questions. I'm going to just evaluate your speech and your memory. Can you tell me your name and date of birth?
Ethan Murine, June 13th, 1983.
Can you tell me where you are?
I'm in my house. I'm in the doctor's office.
Can you tell me what month it is?
It is November. Just more today than tomorrow's December.
Yeah, true. Okay, well, this is a little bit of long-term memory questions. Can you tell me something about your school history, like how long you've been in school?
I'm in nursing school right now, and I was in college before that, so this is my 4th year in college in a row.
And can you tell me do you remember where you were on 9/11?
I was sitting in high school class. I don't remember what class, but I was in school.
In high school. Okay. Okay, I'm going to check you, see if you can calculate a couple simple problems for me. Can you tell me what 4 plus 3 is?
7.
How about 8 divided by 2?
4.
15 minus 4.
11.
And how about a bigger one? 100 minus 7.
93.
Alright, and this is going to test some abstract thinking. If you can you explain to me what this phrase means? Don't put all your eggs in one basket.
It means have a backup plan.
And this, we're going to assess your mood. How are you feeling today?
I'm fine.
Any recent changes in your mood for any reason? No
Nope.
stress or anything?
No, feel fine.
How about any plans for the future that you are making?
I'm in nursing school right now, and I don't know. We'll see after that. That's enough for right now, I think.
I agree. Okay, so it seems like the patient, his abstract thinking, his long-term memory is intact. Mood seems to be stable, no sudden changes or anything, and he is able to have some perception of the future, and his judgment is intact. Okay, this is going to be a series of tests where we're going to check your senses and make sure that your cranial nerves are functioning the way they need to be. So our first one we're going to have you check if you can sense some smell. So I'm going to have you close your eyes, hold one side of your nose, and then I'm going to put a smell underneath your nose.
That one's clogged up. Okay.
Do you need to blow your nose first?
No, that should be okay.
Alright, I'm going to put a smell under your nose and you let me know what it is.
Coffee.
It is coffee. And can we try the other side or no?
Yeah. Okay. Same as
You
smell.
still smell it? Okay. Alright, so that's working. Okay, we're going to check just some vision here. I'm going to have you read something close up, and then I'm going to have you read it farther away. We'll see if your vision fields are intact here. So just read the smallest line that you can on there.
XBDFCA.
Okay. And then I'm going to hold it back a little further, and you just try to read the same line.
XBDC. I can't.
Okay. And then I'm going to have another visual test here. All I'm going to have you do is just look at the tip of this pen light, and we're going to check your vision, field of vision. So I'm going to just move it in different directions, and you just follow it. Alright, good. Okay, this is going to be another sensing. I'm going to take this, well, we'll tear this cotton so we have like a little cotton edge. You just go ahead and close your eyes. I'm going to touch you somewhere. You tell me where it is, or when you can feel it and where it is. Okay.
Left arm. Left cheek. Right arm. Left hand. Wrist.
Here's your hand.
Hand.
Alright, keep your eyes closed. I'm going to use this tongue blade here. There's a sharp end and there's a dull end.
Okay.
You just tell me when you feel sharp and when you feel dull.
All right.
Okay.
Sharp. Sharp. Dull. Sharp.
All right, you can open your eyes then. Go ahead and close your mouth, but like clench your teeth together. And then open your mouth, close your mouth, open it again, and close it. Okay. So all his sensations for those cranial nerves seem to be intact. He was able to open his mouth symmetrical, and we're going to do a couple more tests to show that also. I'm going to have you, can you smile? And how about frown? Close your eyes. Open your eyes. Go ahead and raise your eyebrows.
I can't only raise one if that's what you're going to ask me.
No, I'm not going to ask you to raise
Okay.
just one. Go ahead and close your eyes and try to resist me opening your eyes. Good.
I did the wrong thing first.
That's okay. And go ahead and can you close your mouth and puff out your cheeks? Okay. So facial movements look symmetrical. There's no drooping of either side for that. Another thing we're going to test here is we're going to test your taste.
Okay.
So go ahead and close your eyes.
All right.
And then you're going to tell me...
A lot.
Alright. I'm going to put this on your tongue. You're going to tell me if it's salty or sweet.
Okay. Salty.
Alright. Do you need water in between?
No.
Okay. Alright. And then this one, same thing. Salty or sweet?
Sweet.
Yep. Alright. Normally we would use lemon also as a sour taste, but I don't have any lemon, so we're gonna pass over that one. The next thing we would normally check for is we would use the tuning fork to check the is it Rennie?
Yeah.
The Rennie test and the Weber test. I don't have a tuning fork, but if we were going to do the Rennie, we would be checking for the bone versus air conduction, and it would be a 2-to-1 ratio normally. And then the Weber test, it would be, the normal is they would hear lateralized sound equally with both ears. The one test that I can do is if you want to stand up, I'll do this is a Romberg test. We're going to check your balance here. So go ahead and just, all you need to do is stand with your feet together and close your eyes. And he looks like he would pass the test because he's not swaying or showing any big movements with his eyes closed. Didn't get worse when he closed his eyes. You guys tell. Oh, next cranial nerve we would check. I'm going to have you do, need my tongue blade. Just go ahead and I'm going to have you open your mouth. I'm going to use the tongue blade and push your tongue down. And we're going to check, not just say ah. And what we would be checking for here, we would just be looking to see if the soft palate was rising when he said ah. And I would also be checking for his gag reflex, but I'm not going to go ahead and do that. We would just touch the uvula to see if there would be a gag reflex intact. Next we're going to do, I'm going to have you do a couple more movements to see if your next cranial nerve is intact. I'm going to have you shrug your shoulders. Turn your head to the right. Turn it to the left. And then go ahead and put your head center and try to touch your ear to your right shoulder without lifting your shoulder. Good. And then try the left. Alright, and then I'm going to have you shrug your shoulders again, but I'm going to have you push against my hands. Good. And then I'm going to have you turn, but I'm going to have you turn against my hand this way. Okay. And then we'll try the other side. Alright, I'm going to check your movements of your tongue also. Can you take your tongue straight out? And then how about to the left? And to the right? And I'm going to have you push your tongue against your cheek, but push against my fingers. Okay, and the other side. Alright, we're going to have you check, I'm going to check you some motor functions here, so I'm going to have you stand up. Can give me a couple heel toe steps just forward. Okay. And then come back. Alright, and he looks like he's able to do that. He has a steady gait. There's no shuffling. Oh, stand up. I need to do the heel to the shin. Next thing you're going to do, just take your heel and you're going to put it on your shin and trace it all the way down to the floor. Normally we would have the patient probably lying down for this test, but we don't really have an exam table for him to lie down with, but he was able to do that without any difficulty. Alright, you can sit down. Alright, and then we're going to have the patient, we're going to do another test where they would take you're going to have your arm straight out and you're going to bring your hand into your nose. Well, first we'll do it with your eyes open. So just bring your right arm in and bring it in and touch your nose, and then right back out. Okay, and then same thing with the left hand. Alright, and then if you close your eyes and do the same thing. Okay, good. Next thing, go ahead and leave your hands face down, and then I want you to flip them palms up, and then flip them back down, and then faster, palms up, palms down, and faster one more time, palms up. And then the last motor function we're going to check is if you're going to take your thumb and touch it to each finger individually. Okay, and the other hand. Okay, and all those sensations are intact for the patient. You would check, another section would be for the sensory nerves. We did do some already with the sharp and the dull and the feeling of the cotton swab. We're going to do another test where we can see if the patient can identify an object. So if you close your eyes and hold out your hand, I'm going to give you an object. You just tell me what it is by feel.
The coin.
It is a coin. I'm going to keep your eyes closed. I'm going to do a couple more things. Keep your palm, you put your palm face up, and I'm going to draw something, and you tell me what it is.
B.
And how about, we'll try the other hand too.
I don't know, do it again.
Okay. Maybe the bad one.
M.
Yeah, there you go. Alright, and then, well, we did do that already. Another sensory test that we already did do earlier in the exam would have been the identification of different points that they were touching. He was able to, you can combine that with the cotton swab test. Instead of just saying now, they would say the location of where you were touching them. And then the next we would do was just check the different reflexes, which I don't have the reflex hammer. But if I was, and we also don't have an exam table high enough where he would be able to dangle his legs. But what we would do normally to check the knee reflex is we would hit right below the patellar, and there should be a reflex that happens once you hit it. Like I said, he can't really dangle his legs from where he's sitting. And we would also check the bicep. Right in this area. We would check the tricep by having them hang their arm. And then we would also check the ankle by hitting the Achilles tendon with the flat end of the hammer. And I think that would bring our neuro assessment to a close, and it seems like our patient did pretty well. So thank you for your participation.